For people with diabetes, hypoglycemia, also called a hypo, can occur. A hypo occurs when the blood glucose is less than 4 millimoles per litre or 72 milligrams per deciliter. This can be caused by too much medication, not enough food or too long between meals, more exercise than usual or unplanned exercise, drinking excess alcohol, stress. Many people will suffer from a hypo occasionally, but if you are well prepared and are able to control your diabetes, hypos should be minimal and easy to treat. Hypos have very distinct symptoms, including some of these: hunger, dizziness, sweating, palpitations, pins and needles around the mouth, headache, a blood glucose level of less than 4 millimoles per litre. Wherever you are, you should be prepared to treat a hypo. The treatment is quick and effective. There are 2 stages. Have some fast-acting carbohydrate, high glycemic index food to bring the blood glucose levels back to normal, such as 4 or 5 dextrose or Lucozade tablets, or a small glass of grape juice. To ensure your blood glucose does not drop again, you then need to have some slow-acting carbohydrate, such as a piece of fruit, a yogurt, a sandwich, 1 or 2 biscuits or crackers. If you have a hypo more than once a month, you should discuss this with your diabetes specialist, as you may need some specific advice to stop this happening, or a change in medication. People with diabetes are more at risk of becoming very unwell when they are ill or have flu or pneumonia. To reduce your risk of getting flu or pneumonia, you are entitled to have a flu and pneumonia vaccine. The flu vaccine differs each year, so you should have this vaccine on an annual basis, usually in October. The pneumonia vaccine is a one-off dose, so if you've not had this, ask your GP about it and get protected. When you have diabetes and are unwell, your body releases hormones that causes your liver to release glucose and interfere with the action of insulin. This makes your blood glucose rise, sometimes to dangerously high levels. When you are ill, your diabetes will be harder to control. To help keep your diabetes well controlled, you should always continue taking your diabetes tablets and insulin. Check your blood glucose more regularly, at least 4 times a day, to see if you need to alter your treatment or seek medical advice. Drink plenty of water, at least a glassful per hour, to avoid dehydration. If you cannot eat solid food and your blood glucose is low, replace meals with soups, sugary drinks, or milk to give you energy to fight the illness. If your blood glucose is high, you should drink calorie-free liquids such as broth, sugar-free fizzy drinks, caffeine-free soft drinks. If you take insulin and have high blood glucose levels, you can increase your mealtime insulin dose as you have been advised by your diabetes specialist. If you have type 2 diabetes and any of the following symptoms, you should seek medical advice if your illness has not improved after 2 days. You have had very high blood glucose for longer than 24 or 48 hours. You have been unable to drink any fluids for over 4 hours. You have an illness which needs medical treatment. If you have type 1 diabetes and any of these symptoms, seek medical advice urgently. If your blood glucose is higher than 15 millimoles per litre and you have ketones in your urine. If you have stomach pains or nausea and vomiting. Rapid breathing or a rapid pulse. Weakness or tiredness or difficulty staying awake. Blurry vision. Cracked lips or dry mouth. You have been unable to drink any fluids for over 4 hours. You have an illness which needs medical treatment. Weddings and celebrations are important in everyone's lives, but they can also be a time when looking after your diabetes can be even more challenging than usual. You may not know when you will be eating or what food will be available. You may also do much more or much less exercise than usual, depending on your usual routine. Some tips for enjoying special occasions are: if you can, take your blood glucose meter with you and test your glucose levels regularly. Have a couple of long-acting carbohydrate snacks with you, such as a cereal bar or fruit, in case there are large gaps between meals or courses. Try not to overindulge in buffet foods. They are often high in saturated fats or cooked in oil. Try to make healthy choices from the buffet. Don't forget to have some vegetables and fruit with your meal. Don't forget to take part in dancing and enjoy yourself. Having diabetes does not prevent you driving a car, as long as your diabetes is well controlled and your doctor agrees you are safe to drive. It is your responsibility to inform the driver and vehicle licensing agency if you are taking tablets, except metformin only, or insulin to treat your diabetes. You also need to inform your insurance company that you have diabetes. At each renewal, update them on any changes in your condition or treatment. If you have diabetes treated with insulin, there are some restrictions on your license. Your diabetes specialist can advise you in more detail about this. Before setting off and during a long journey, you should make sure you have some essential items with you, so you can drive safely and reduce your risk of accidents. Stop every 1.5 to 2 hours and test your blood glucose level. If it is lower than 6 millimoles per litre, eat some slow-acting carbohydrates, such as a piece of fruit or a sandwich. Ensure you have some treatment for hypoglycemia, food, water, and a supply of your medications. If you feel a hypo is starting, stop the car, take the keys out of the ignition and move into the passenger seat. Then treat the hypo with quick-acting carbohydrate, such as 4 or 5 glucose tablets. Then have some slow-acting carbohydrate, such as a banana or sandwich. Do not start to drive again until your blood glucose is back above 6 millimoles per litre. Regular travelling is now a part of everyday life for many people. When you have diabetes, you need to be well prepared to ensure you are travelling safely. For even short distances, such as going to work, a shopping trip, or hospital appointment, you need to be prepared for potential problems. The most common problems are hypoglycemia and forgetting to take medication. Points to remember are: have I remembered to take my medication? Should I take my medication with me in case I am delayed? Have I got my diabetes ID card with details of my next of kin? Should I take my blood glucose meter? Have I got some carbohydrate with me in case I miss a meal, such as a cereal bar, a piece of fruit, or a couple of crackers? Many people now regularly travel overseas. When you have diabetes, you should make sure you are prepared for both your journey and your stay. Your journey may be several hours, so make sure you have the following: blood glucose meter, strips, and lancets. Enough medication in your hand luggage for at least 48 hours. If you take insulin, remember to pack this in your hand luggage. A letter from your health professional explaining that you need to carry insulin and needles. Emergency food supplies and treatment for hypoglycemia. A diabetes ID card. If you plan your trip well, you will be able to enjoy your holiday without any problems. Your diabetes specialist can help with specific advice for you. For all overseas travel, you should ensure you take a simple first aid kit containing items you might need, such as plasters, painkillers, treatment for diarrhea. Have adequate treatment for hypoglycemia. Take twice as much medication as you require. If you take insulin, keep it cool and intact. Take plenty of needles, a spare pen, and a sharp spin. If required, pack some protection such as a hat, long-sleeved clothes, and high-factor sun cream. Take change of time zones into account and think about how these will affect your medication. Check if you require vaccinations and malaria prophylaxis as early as possible before departure. Whilst you are away, check your blood glucose regularly. Be aware that your usual lifestyle changes when you are away from home. You may eat more or less and exercise more or less than usual. If you take insulin, your dose may need to be altered to adjust for this.